Good afternoon, everyone. It is my pleasure to welcome you for today's lunchtime chat in the Mount Sinai Institute for Exposomic Research, Environment and Health series. I'm Luz Gell, the Community Engagement Coordinator for the NIHS Environmental Health Core Center at the Icahn School of Medicine at Mount Sinai. Our center is the multidisciplinary center research hub for the Mount Sinai Institute for Exposomic Research. Each week, we feature one of our scientists studying the health impacts of complex environmental exposures. Today's presentation will be about 25 minutes, followed by 20 minutes for Q&A. I encourage you to submit your questions using the Q&A function. If we can't get to your questions, we will work to get to your answers, shared on social media using the hashtag environmental chats. You will hear this again. I want to emphasize that we encourage individuals to reach out to us with any environmental health concerns they have in their community. We welcome new partnerships so we can learn about specific issues facing communities, and we can in turn provide the science to help you build healthier and more just communities. It is my pleasure to introduce our speaker today, Dr. Maida Galvez, a nationally renowned pediatrician and trusted voice on children's environmental health. She's also a professor in the Department of Environmental Medicine and Public Health and the Department of Pediatrics at the Icahn School of Medicine at Mount Sinai. Dr. Galvez works to translate research into programs and policies that prevent and reduce environmental exposures for children, their families, and their communities. She is the founding director of the New York State Children's Environmental Health Center, the first statewide publicly founded model for children's environmental health services in the US since 2006, has served as the director of the CDC EPA-funded Region 2 Pediatric Environmental Health Specialty Unit. Dr. Galvez leads several Sinai initiatives to build researchers together with community partners to work on environmental health and environmental justice issues to directly benefit those communities. Dr. Galvez is a member of the Institute for Exposomic Research at Mount Sinai. And with that, Dr. Galvez, please take the stage.
Thank you, Luz, and so glad that you could all join us today. I'm just going to share my screen. So today's talk is titled Working Together Towards Environmental Health and All Policies, and I'm really thrilled to be joined by Luz today as the moderator. Thank you, Luz, for doing that. I know how busy you are. So when I rejoined Mount Sinai in 2002 as an environmental pediatrics fellow, it changed my life, and it changed the career path for all the fellows that followed. There are actually 9 environmental pediatrics fellows in this photo that you see, including my partners at work, Dr. Perry Sheffield and Dr. Lauren Zajac. And these fellows are now seated in children's hospitals and federal public health agencies like the CDC throughout the country. And we were mentored by this national network of environmental clinicians that found their way to the practice of environmental pediatrics. And the fellowship started because they wanted to train a pipeline of future leaders. And we were all warmly welcomed into this incredible community. And in my case, I was co-trained by an interdisciplinary team of researchers working as part of the then funded National Institute of Environmental Health Sciences, or NIEHS, and Environmental Protection Agency, Children's Environmental Health Research Centers. And by this co-mentorship by clinicians and researchers, we fellows learned evidence-based health messaging. We learned rapid response, specifically for children in the aftermath of disasters. We learned the practice of clinical environmental pediatrics and how to conduct community-partnered research rooted in team science, and also how to effectively communicate study findings back to study participants. And all this work was rooted in community partnerships, which ensures that the work that we do directly benefits families and communities. And for those of you who PACU is new, this is the website that you can go to for evidence-based health messages, whether you're a health professional or a member of the general public. It's pacu.net. It is a way to curate actionable messages for families, and I encourage you to check it out. It's funded by CDC and EPA, as Luz mentioned, and managed by the American Academy of Pediatrics. There are 10 PACUs in each federal region in the country. Our PACU at Mount Sinai covers New Jersey, New York, Puerto Rico, and the US Virgin Islands. And it's our co-director, Dr. Perry Sheffield, that leads our initiative specifically in Puerto Rico and the US Virgin Islands, together with our project coordinator, Teresa Herrera. And what they do is work together with community partners there to ensure that we begin to address the environmental health needs of families in the Caribbean. And so they've worked in areas as diverse as climate change, to hurricane relief and recovery, to eco-healthy childcare trainings as part of the Children's Environmental Health Network's program, together with environmental pediatrics champions like Gredia Huerta Montañez, who is the go-to environmental pediatrician in Puerto Rico and has been an outstanding voice for children there. She also is a former fellow in environmental pediatrics funded through a Region 2 EPA supplement, specifically to work together with our partners at University of Puerto Rico to build a pipeline of future leaders there. And it's amazing to witness Dr. Huerta's local leadership, but also now her national leadership. And a direct outgrowth of the National PACU network has been this network here in New York State. It's called the New York State Children's Environmental Health Centers. It's the first statewide publicly funded model for children's environmental health centers in the country. And we hope it's just the first. And we'd love for New Jersey and Puerto Rico and the USVI to be next, and other states and territories to follow. And what you see here are members of our Nice Check network. So I mentioned there are 10 PACUs in the country. There are 7 Nice Check centers in New York State located at children's hospitals in Albany, Buffalo, Syracuse, Rochester, Westchester, New York City, and Long Island. And we're joined in this photo at our second annual meeting by community partners in our network, as well as advisory council members made up of, for example, community-based organizations and public health agencies. And I just want to point out that there's an article talking about how this model came to be in the American Journal of Public Health. And you can see the title of that article in the bottom right-hand corner. And what we decided as a network is that housing would be a priority environmental concern for us to address, because this is a cross-cutting issue, whether you're in an urban, suburban, or rural area. The home should be a refuge for families, and for many families, it just isn't. And this is an example of a data story from the New York City Department of Health's Environment and Health Data Portal. And if you haven't visited this portal, it's an incredible resource where you can plug in your zip code and get information about environmental exposures and how they compare to other neighborhoods and the city as a whole. And you can also see trends over time. And what this data story shows is how certain neighborhoods, particularly Black and brown neighborhoods in New York City, are disproportionately burdened by environmental concerns. So the darker red neighborhoods are those that had 3 or more healthy housing problems, categorized as problems with rodents, pests, or cracks and holes in the walls. And underlying these problems are is in fact environmental racism, and the fact that federal policy drove residential segregation that ultimately leads to the disproportionate burden of environmental exposures that certain communities face that then result in existing health disparities, like increased rates of asthma and childhood lead poisoning in these very same neighborhoods. To address this, the step forward that the Nice Check network has taken is we're not waiting for people to call our toll-free hotline. Our clinical directors, Dr. Lauren Zajac and Dr. Erin Thanek, are working together with general pediatrician Dr. Leora Mogilner in the general pediatrics clinic to integrate environmental healthy home screening as part of routine well child care and part of social determinants of health screening in the pediatrics clinic. So I myself practice a little bit of general pediatrics, and it's hard for me to get to healthy homes concerns in a busy 15-minute visit. And what this team is doing is trying to make it as simple and easy as possible for the pediatrician, the nurse, the asthma counselor, the social worker, a medical student, an MPH student to even think about integrating environmental health into pediatrics practice. And Dr. Thanik is doing this in the Peds Home Clinic and Peds Allergy Immunology Clinic, screening families with children with asthma for environmental health concerns and connecting them to Healthy Homes interventions. And for folks that are interested in learning more about these programs, Dr. Zajac and Thanik will be speaking at this environmental chat next week. And so what this team is doing is prescribing healthy homes. And so you can see the conditions that many families here, right here in our backyard, face on a daily basis, and how challenging it is for families to get these concerns met. And I always find when I go out and give talks that many people don't understand the substandard housing conditions that exist right here in New York City and throughout our state and beyond. And it's really important for people to know that there are these substandard housing conditions that are widely experienced by families, and it's a constant source of toxic stress, particularly in the time of COVID when families are spending more time at home. And so the environmental pediatrics program aims to screen, counsel, and refer families to Healthy Homes interventions. And we screen using a short screener called the Environmental Health e-Screener, electronic screener, that identifies priority environmental concerns that are actionable. It boils environmental messages down into key messages in this prescription for prevention, and then it refers families to Healthy Homes interventions. And this clinical tool, the prescriptions for prevention, were developed out of a National Institute of Environmental Health Sciences intercenter collaboration grant that brought together 5 pediatric environmental health specialty units together with 5 community engagement corps in those same regions. And together we developed initially environmental asthma trigger prescriptions for prevention, and we've moved on to additional environmental concerns as well. These prescriptions for prevention are being tailored and disseminated through our Nice Check network, through the National PACE network from some regional partners, and also through community engagement corps. And then we refer and to those Healthy Homes intervention. And here's one local to our East Harlem community, Little Sisters of the Assumption Family Health Services. And you can see here how they work to address some of the persistent problems that families face, like problems with pests and roaches. Other partners that we refer to include Air NYC and the Department of Health's Healthy Homes programs, for example. And Dr. Zajac and our project lead on this, Jen Acevedo, and Dr. Mo Gilner, are really working to meet the needs of families in COVID. So they've launched a food pantry and the pediatric clinic where over 600 food packages and Healthy Homes kits have been disseminated. And this has been organized together with social workers and trainees, where families then get enrolled into New York Common Pantry and receive a follow-up phone call within 1 month to see if there are any additional needs on the part of the family. You can see a picture of what the Healthy Homes kit contains, and they're largely items that help address environmental asthma triggers. Because the Environmental Pediatrics Fellowship has benefited so many, we thought this was really a vital component of the Nice Check network. And so through Nice Check, we've launched an Environmental Health Scholars Program, which is a 1 to 2 year program where fellows of a variety of backgrounds get protected time to advance some of the core areas related to our Nice Check work. They're seated at centers across the state. And you see the 2 different cohorts of fellows that have been trained so far. So we have 10 scholars in total, 5 in the first 2 years, and 5 current scholars. And what's been amazing to witness, even in that first cohort, is to see how the scholars have now become leaders for our network, including Sandra G, who's pictured on the far left, who went from a scholar as a mid-level general academic pediatrician and is now medical director of the Finger Lakes Children's Environmental Health Center. And on the far right of that first cohort, Georgia Ben-Sherry is now a medical student who we hope will pursue environmental health in whatever field she chooses. On the bottom right, you see the interdisciplinary fields that folks come from include nursing, respiratory therapy, community organizing, a project coordinator, and even a postdoc. And so what we wanted to do is seed champions in a variety of disciplines and fields at our partner centers. And this program is led by Deborah Nagin, former director of the New York City Department of Health Healthy Homes program, and co-led by faculty mentors from the different centers, as well as Sophie Balk, an environmental pediatrician at Montefiore, who is the editor of the Handbook on Pediatric Environmental Health. So it really connects these scholars to a diverse network of mentors across the state and nationally. And to seed the pipeline of these types of programs, one of our lead community partners with the Long Island Children's Environmental Health Center is Karen Miller and Melanie Gabrell of the Huntington Breast Cancer Action Coalition and Prevention is the Cure. And they've done such phenomenal work with youth, really training them in environmental health and getting them to be the key messengers. And so you see on the left, two of the summer interns from Huntington who came into Mount Sinai, worked with center scientists, Dr. Sarah Evans, who you may have heard in the inaugural environmental chat, and interviewing her on artificial turf. And they've gone on to be local leaders for environmental health in their, at their high schools, in their communities, and then gone on to attend national meetings. And you can see Savannah on the bottom right, pictured with former director of the National Institute of Environmental Health Sciences, Dr. Linda Birnbaum. Savannah also keynoted our annual celebration of Children's Environmental Health Day and brought down the house. She was literally the featured speaker that day. And then going even younger, so Children's Environmental Health Day is something we celebrate every year, going back to 2018. This is part of a national campaign that was begun by the Children's Environmental Health Network. On that day, at that very first celebration, October 2018, we had this 5-year-old submit a video of him singing the proclamation that we had received from the New York State Assembly. And it was phenomenal to see youth take messages and make them their own. And he's literally taken that message. We say that his tweet is our one tweet that went viral. And so we call him our closer. And what he sang, which I will spare you from singing myself, are these words from the proclamation. The aim of Children's Environmental Health Day is to raise awareness about the importance of clean air and water, safe food and consumer products, and healthy environments to children's health and development. And it shows you that we need every voice in promoting healthy environments for all. And sometimes the most effective voices are not our own. From a research to action perspective and in our community engagement work, and this is where Luz Gell plays a lead role, is bringing in diverse partners into the academic research enterprise and making them real partners in our work. So it's here that we get to work with people of all different backgrounds, whether it's housing or law or architecture, design, or public policy, or environmental advocacy, and think through common concerns and how we can work to address them together. And these are some of our community advisory board members, which we call our Environmental Health Accelerator, and who have worked with us both in the past and in the present. And I'm going to highlight for you some of the work that we've done together. And so this is some of the work, again, with youth that Luz Gell has played a lead role in. So she's worked with the Children's Environmental Literacy Foundation, an organization that works to train teachers to incorporate environmental health into STEM curriculum, both in middle and high school, in public and private schools, not only across the city and state, but across the country. They've trained thousands of teachers and thousands of students. And this is a program that you see here where they taught students to collect data using a portable air monitoring device, taught them how to interpret and use that data and come up with youth-powered solutions to the environmental concerns that they were collecting data on. And so this is true community science. And then the students get to present their work to a team of experts and get feedback. And it's really a phenomenal thing to witness them telling their stories of their data collection process and what it means to them. This was a super exciting event. It's the National Institute of Environmental Health Sciences Partnerships in Environmental Public Health meeting, where they had a film fest. And one of our stakeholder advisory board members, Professor Rebecca Bratsby's, who directs the Center for Urban Environmental Reform, had developed an environmental justice graphic novel with a former DC Comics animator called Maya's Lot. And Maya's Lot is a story of how you can address a local concern and move it towards action. And we worked together with Professor Bratsby's to transform this graphic novel into a short film, both in English and Spanish, that's then used by law students to teach environmental justice and community organizing in schools, again, for middle and high school students. And you see on the stage, Professor Bratsby is joined by Luz Gell at that film fest when the short film premiered. It was pretty amazing to witness. Another innovative partner are our architecture and design colleagues at Parsons New School for Design. And Allison Mears and Jasara Ruth lead the Healthy Materials Lab at the New School. What they've done is they've taken center scientists and they've put them in front of an architecture and design audience to talk about how the built environment impacts health. And they've incorporated it into their online curriculum for those architecture and design students into their academic meetings. And we've worked together on podcasts, for example, for the US Green Building Council. And it's been kind of amazing to sort of see that it takes partnerships like these to really make a meaningful impact when it comes to the wide-scale implementation of the use of healthier and safer materials in places like Head Starts and affordable housing. And that is their primary goal. We've also gotten a chance to work with their students in data visualization to think about how to message and improve our messaging with their expertise. So it's really been a novel partnership. And they're working together with center scientists, Dr. Aurora and Dr. Evans, to create innovative report back study tools. And this was truly exciting. As someone who in fellowship, my work was really focused on looking at the local food environment and the built environment and how that shapes childhood diet, physical activity levels, and risk for obesity. To see that work come to this culmination, and this was a partnership with our P30 Community Engagement Corps, and Luz, again, played a major role in working with New York City Housing Authority's Tenants Association here to get their input on their needs related to the design and implementation of this adult fitness zone. And the adult fitness zone actually is accessible to teens as young as 13 years old. It was a public-private partnership together with NYCHA Public Housing, specifically Andrea Mata and the Trust for Public Land, Andy Stone. And it took many years to work together with these partners to get this to the finish line. And the ribbon cutting was January 9th, 2020, which is right before the pandemic hit. And New York City went into shutdown. And I think that we can all agree that having access to outdoor spaces over the last year has been so vitally important. And we know from our past work that the disparities exist, both in access to green spaces and access to structured physical activity program. So we were really thrilled that this was there in place pre-pandemic. And I'd never really thought of green space and parks and playgrounds as public health preparedness. But COVID has really shined a light on how they truly are and how this is a vital, how these resources play a vital role in promoting healthy communities. So if you heard Sarah Evans' presentation, she talked about the importance of legislation and how we really don't want to burden the consumer with navigating a truly complicated, how challenging it is for families to navigate fact from fiction and also understand what is in fact safe. So the one proven way to reduce exposures universally is legislation. And so this is a picture back from 2014 where community partners, environmental advocates, and others were championing the need for the Child Safe Products Act. And that wasn't the first year they had championed the need, that was just one of many. And that advocacy continued every year for many years until 2020, when the Child Safe Products Act was signed into law. And we used to sort of joke, who's against safe products for children? How could that be possible? But it took many years for this to get passed. And it was because of the dedication of environmental advocates from the Just Green Partnership over many, many years. And they not only ensure that legislation like this makes it to the finish line, but they also work to ensure that once it's implemented, that it makes sense and that it is in fact implemented in a way that reduces and prevents exposures. At the time, at this photo below, the Just Green Partnership was led by We Act and Clean and Healthy New York, Cecil Corbin Mark and Kathy Curtis, two champions in environmental health. And we were really sad to see the passing of, it was a great loss in the last year of a true leader when we lost Cecil. And so just want to honor him. And we were so glad we had the chance to honor him at a Children's Environmental Health Day event. So what this shows is it truly takes a village. And these are just some of our many, many partners to speak with one voice and get to the finish line. And I think one of the things that our team at Mount Sinai is most proud of is that when I began as a fellow, it was me and my two mentors. And so we were a team of three, and it was slivers of our mentors. They weren't even full-time environmental pediatrics. And so the team has grown at Mount Sinai. And what has happened is there are these emerging leaders in both faculty and staff. And it's been amazing for us to witness the rise of this new leadership like Luz, Teresa, Michael, Jen, and others. And we're really, really thrilled to sort of see them take the baton and make a difference. And they already are. And I know that great things are in store for them. This team not only has grown, but we've grown in our partnerships. And we're grateful to all of you, as I know that there are many of you in the audience that we work with on a regular basis. And it's because of these partnerships and these collaborations that we can get the job done. And so the roadmap to change is, and where we want to get to, is environmental health in all policies. And I think that we're actually in a better place now than we were even just a couple of years ago. And so I talked at the very beginning about starting almost 20 years ago and witnessing change in that 20-year period. And I think that just a couple of years ago, we were saying that people didn't understand environmental health or environmental justice. And I think that has profoundly changed in the last couple of years because of incidents like Flint and now COVID. I think people, we don't have to explain it to people as much. And because of that, I think we're really going to be able to make the change that we want to all see in the coming years to affect some of the priority concerns like climate change. And what we need to do to get there is invest in future leaders, build new partnerships across diverse sectors. I talked about the different partnerships that we have that really lead to a community of learners rooted in interdisciplinary mentorship, but not only interdisciplinary mentorship, but mentorship across ages and stages of training. And where we want to get to is the application of an environmental justice lens to all our work. And so that we get to a place where we amplify our messages and all speak with one voice. And some opportunities to do this, we just celebrated a National Healthy Schools Day on April 6th. Here's a message that was widely shared on social media. You can go to the CDC APHA National Environmental Health Partnership Council's website to continue to share messages on why ventilation matters in schools. Earth Day is coming up, another chance for us to speak with one voice. And CDC APHA, our team at Mount Sinai, others will be sharing messages. Please share and reshare those. And then in October, we have our upcoming Children's Environmental Health Day. If you want to request a proclamation, the toolkit can be found on the Children's Environmental Health Network's website. And now may be the time to ask your local legislators. And we've already asked our New York State Assembly, and we'll be asking New York City as well. And you can see what other cities, states have participated in the past in CEHN's website. There's also an art contest. So we're trying to envision the future. What does the post-COVID New York City look like, New York State and the country? Anybody can enter. Please send us your entries. We'd love to dream with all of you about what healthy community looks like moving forward. So entries are due before Children's Environmental Health Day, October 14th, 2021 this year. And with that, I think I went a little bit long. I'll turn it over to Luz Gale.
Thank you so much, Dr. Galvez. You're truly a fearless leader, and it's really an honor to be able to co-lead so many amazing programs with you, and a privilege that we get to work together to serve New York City communities. So again, thank you. We're super fortunate to have you part of our team. Before we start the Q&A, I would like to invite everybody who joined us today to get more involved in our work. We have terrific resources that break down the science, and we encourage you to look through our resource library on our website and share the videos from the series with your networks. If you have environmental health or justice concerns in your community, our team is available. Please contact us and to discuss potential collaboration opportunities. Also, we're in the midst of creating a new board to power this pioneering work at Mount Sinai Institute for Exposomic Research, and we're seeking board nominations. We're looking for individuals who are philanthropically motivated to enact change and help us advance a strategic plan. Additionally, we are forming the Children's Environmental Health community for those who want to be supportive and involved, but may not be ready to join at the board level. Please contact us to nominate someone or to learn more. So now let's get to the questions. The first questions, there have been many scientific breakthroughs in environmental health, driving new research fields such as exposomics, which is the study of all of our internal and external environment exposures. As someone who is a leader in environmental health, how would you characterize the field's evolution, and what are you most excited about today?
That's a really great question. I do think that the field is rapidly evolving. And I've witnessed that even in just the last 20 years. And with the advent of biomonitoring, we were able to actually measure environmental exposures in the US population. And because of that, we've also been able to track the impact of legislation and see that once a chemical is banned, you can reduce and prevent exposures universally, which is pretty amazing. And what we're seeing now is that there are new biomarkers, there are new tools that could be used to measure exposure. So we're going from a research world to where they're going to be in the future real world tools for people to use in real time to inform everyday decisions and make it less hard for folks to navigate. And I think that Again, I mentioned how challenging it is, even for us in the environmental health community, to navigate some of these complicated questions. It takes a significant amount of time and research and reaching out to additional expertise. I'm really looking forward to sort of witnessing the field advance to the point that we all have it in our hands, in our iPhones and in our wearables. And we have these simple tools that help us all prevent and reduce exposures. I also am really amazed by the legislation that is passed. For example, the Child Safe Products Act is so huge. I think that makes a huge difference. I think that legislation in moving forward in the future, I think it's just the beginning. I think that because people get it now to a degree that people didn't before, I think that there's greater hope for additional legislation moving forward that is protective of all families' health.
Yeah, and I feel so you really are paving the path for what the future of environmental health looks like. And I kind of wonder, what do you envision the role of environmental health being in addressing environmental injustices? That's one of the main concerns that we have, here in New York City, and needs to be central to a lot of our policies. So I'm wondering, what do you envision as a role for environmental health and addressing environmental injustices?
Yeah, thank you for that question, Luz. And I think that the time is now. It's really, we are faced with such problems in this world that we all are having a hard time processing and understanding. And I think that what's been amazing is that it is working with folks like you, Luz, and others who have done the work to help understand the root cause of these issues that affect Black and Brown communities, not only here, but across the country, and how we need to rethink our structures and come up with new ones to better address the needs of families. And I think it's going to take a lot of work, but like I said, it's this new leadership that's emerging, and Luz is one of them. She's the PI of a new environmental justice grant for our P30 Center, looking at a waste transfer station in Jamaica, Queens, working with community partners to understand how we can better enforce some of the existing regulations. And she's working with Professor Bratzes with a legal background to understand what data collection is needed to show that there are violations in place. And I think that Luz is really paving the way. I think this is a pivotal point in time where our research can really shift to action. And there are many things that we've studied in the environmental health community that we don't need to study anymore, that we know enough about, and it's time to do something. And we're super excited about this shift that's happening, that's being led by these new leaders, and is also shifting at the federal level. So the National Institute of Environmental Health Sciences put out a center grant proposal recently that's really about moving to action. And so we're seeing this at every level, and it's the change that we need to see in order to meaningfully address those environmental justices. And I just want to, again, just credit Luz, Teresa, Blaine Gurma, and others who've been leading these conversations for our team and really showing us the roadmap to change.
Yeah, and it feels one of the ways that we've been able to co-learn is by how do we pass the baton from all the work that was from your own mentors, Maida, passed down to you, and then you mentoring so many of us as well as emerging leaders. I think that passing the baton has been so galvanizing for so many of us, and we feel supported. And it just goes to show you the importance of intergenerational transformation and how we can co-learn from one another, and that a lot of the struggles that you were undertaking have improved, and that there's so much work to be done that can be led by other folks and other leaders in the field as well. So we thank you again for all your mentorship, all your leadership as well. And we'll just get to the last question before we close. So as you, somebody who works specifically in children's environmental health, what would you say are the immediate environmental threats to children's health?
Great question. Already talked about how housing is on the top of the list. Healthy homes, healthy schools are, always top of our list for children. but really climate change. That is the issue. I think that we have leaders in the field that are really thinking through what we can do about it and how we can get that job done. I think that with respect to climate change, one of the things that has been hopeful in the time of COVID is that things happened from an environmental standpoint that we didn't think were possible in terms of improved air quality. So that came at a great cost, which is really challenging, but it shows you that we might be able to rethink the way we do things in order to make a meaningful difference when it comes to climate change. And so I think many in the field of climate change are thinking about the transformational change that needs to happen in the post-COVID world and how we can do it all together. And so I encourage all of you to think about what that change is and how we can commit to a new normal and not just revert back to our old normal that really promotes healthy communities, but also begins to tackle climate change, which is the issue. And really grateful to the scientists, the advocates, and the leaders who are really championing this work, like my colleague, Dr. Perry Sheffield and Dr. Emily Sinai and others.
Yeah, thank you so much. The last question is, can you proactively enroll to participate in the home visits program?
So if you have an environmental concern, there are several ways that you can address them. It depends on your location. If you'd like to get in touch with an environmental pediatrics expert to get information about how to connect with interventions, you can contact your local PACU. You could contact your local Department of Health to get connected to their Healthy Homes program. But those are ways to address your environmental concerns if they're not being met by your clinician. We do work with clinicians as well, both to train clinicians in environmental health screening and counseling, but also to help them answer questions that they're getting routinely in their pediatric practice if you're a practicing clinician out there. You can also call us.
Perfect. All right, we're going to be wrapping up. Thank you again, Dr. Galvez. I hope all of you were as inspired as I was from this conversation, and we hope that you are able to use some of the resources that Dr. Galvez outlined to get involved and take some action. Thanks, everyone. I hope you will join us next Wednesday, April 21st, for our next talk. Doctors Lauren Sajak and Aaron Thanik will discuss common asthma triggers found in the home environment. They will share evidence-based tips for improving indoor air quality, geared at creating healthier homes for all families. And we hope that you enjoy the rest of the day. Thank you so much.